Welcome to the American Med Spa podcast, Medical Spa Insider. This week, AmSpa founder Alex Thiersch is speaking with Dr. Ken Winnard, CEO and Chief Medical Officer of OneLife Health and Performance.
How is everybody? This is Alex Thiersch. I am the founder and CEO of the American Med Spa Association, and this is Medical Spa Insider. Today, we are very lucky to have on the AmSpa hotline, coming to you live from is it West Palm Beach? Is that where you are, Dr. Winnard?
We're in, just a little north of there, Palm Beach Gardens, Florida.
Palm Beach Gardens, that's right. Palm Beach Gardens.
Jupiter and West Palm Beach, yep.
That's right. Yeah, no, I actually had, I know a little bit about Palm Beach Gardens. I had a friend who was from there. It's a very nice area. Dr. Ken Winnard of OneLife Health and Performance. He is a physician who owns which I think is a really interesting practice, probably that is indicative of kind of the way aesthetics and wellness are going. In today's day and age, we're seeing kind of the evolution of aesthetics. And Dr. Winnard, it's great to have you here. If you could, just for a second, just give us a little, thumbnail sketch of who you are and what your practice is like, and then we'll dive into it.
Perfect. So I'm internal medicine trained, specifically in hospital medicine and ICU care. And I left, the hospital setting, went to chronic care management, found there that, I really didn't have the time to spend on prevention and helping people avoid chronic disease. And then, so I started a cash-based concierge practice where we could focus on prevention, take the time needed to really help, people become the captain of their own health ship. And aesthetics complemented that. I felt that, folks who were wanting to take care of the inside also wanted to look good on the outside. And so they complemented each other very well.
Yeah, for sure. No, I think so. So you actually started with the more of the wellness concierge side and then got into aesthetics from there, as opposed to, we see a lot of folks kind of doing the opposite, right? They get into aesthetics first and they start bringing in wellness. I'm curious, and it's so interesting because when we do our data research, it's physicians like you who are, hospitalists, who are general practitioners, who come out and they have this desire, number one, to help their patients, but they also are kind of sick and tired of, the way that healthcare is run. And you are a prime example of folks who come into to aesthetics and wellness. Talk a little bit about how you got there, like coming from, being in the hospital, working in the ICU. Was there a moment when you were just like, oh, man, I gotta do something different? Or how'd that evolve? Were you always a natural entrepreneur, I guess, is also the question.
Right. So no, definitely not. And, it was definitely this journey where, I said, okay, I'm in the hospital. These folks are very sick. They didn't really know how they got there. And didn't, while I'm talking with them, didn't know how they could have avoided getting to that position. So I said, okay, I'll go to chronic care management. I'll get on the front lines. We're the captain of the health ship. And in that realm, I'll be able to educate them and help them avoid chronic disease. Well, in that setting, the way the system is, you're trying to see 30, somewhere between 20 to 40 patients a day, very little time for education. We are just, there to diagnose and then put them on the bill, right? And so, it didn't take very long for me to figure out that insurance was dictating how we practice in that setting, the tests I could order. And there wasn't, I felt like I didn't have the autonomy to do what I thought was right for my patients. So I knew I had to go cash. So then the next step was, okay, now I got to get myself out of this model and into a cash model. So I looked at, concierge practices, how they were doing it. I made the shift over. And, really it was starting just with me, and maybe one other employee, and I had to build from the ground up. And that was a big leap to take, at the time. And, we just grew from there. And slowly as I, started putting the pieces of the puzzle together of how I was going to help people take control of their health, I knew that we had to have the education for folks. So we had to bring in health coaching. I knew I needed, what are the things that are going to help people age better and live longer? Well, I knew hormones was a big, part of that. So I had to get trained on hormones. I knew nutrition. And so slowly, self-educating myself, going and looking, some of the in organizations that, were forward thinking, like the A4M, and eventually that's how I came to find you guys too. It was a lot of self-teaching and really, just kind of trying to pave the way for myself there.
Yeah, it's first of all, how long ago was that you started your concierge practice?
Yeah, in 2016,
Okay,
I started to make that transition. So, and then, I opened my first practice to about 2017. I worked with some other providers to learn hormones. I had to seek out, specialists in that area and find mentors. And then from there, the first practice I opened, I thought we would cover all the bases and where people were failing and taking care of themselves. So, I think we were a little overzealous, but we had a teaching kitchen, a training facility, and the medical clinic all under one roof. And the goal was to cover the bases and where people would fail. And so, as a new entrepreneur, new business owner, I might have bit off a little more than I could chew. And so that was in Tallahassee, Florida, and where I did my training. And so the demographic might have not have been quite there yet. So I was like, all right, if I move back home to where I'm from, to Palm Beach Gardens, or from Jupiter, I'm from Jupiter, but I said, I'll bring the practice here. I think that demographic may fit the model a little bit better. I knew that folks that were interested in looking good on the outside also probably would be right for wanting to be, healthy on the inside as well. And so we added aesthetics to the practice at that time, and we launched OneLife Health and Performance, which, encompasses, everything for prevention and longevity, and also adding that aesthetic component so we could cover the whole body and help people feel as good on the inside as they do on the outside. Yeah.
I think that's, that's where this is going. And we're seeing that more and more, but I have to back up a little bit. Did you say you had a kitchen in your first office? Is that what you said?
Yes.
And what was that for?
It was to educate people on how to cook for themselves. Gotcha. And, in what a healthy diet looks like. After interviewing lots and lots of folks, our patients, they may have an idea of what they think healthy eating is. But there's just so much misinformation out there. The food industry has done such a good job of making people think, certain foods are healthy and that kind of thing, that it's, even when folks think they're eating healthy, a lot of times there's a lot of room for improvement there.
Yeah, for sure. For sure. So this, so coming down to Palm Beach Gardens and opening up, it's interesting. Your clinic is called OneLife Health and Performance, which, typically when we're doing these podcasts with folks in the med spa industry, it's Ken's Aesthetics, right? Or OneLife Aesthetics or OneLife Med Spa. And yours is very different. And I understand that's in some ways because you started out with the wellness first. Aesthetics though, is also there's a lot of, interplay between the two, but it's also a very different industry, right? And it's kind of its own thing where you have to learn that as well. What did you do? And I asked this because I know there's a lot of folks out there who are looking to get into aesthetics, who want to open their med spa, but are a little bit intimidated, don't know how to do it. They want to get into wellness either. What's some advice for some of these physicians that are out there that want to learn, that want to do it, but they're a little bit reluctant because of the market, what they hear, and they think it's going to be expensive? What's some advice you can give them?
Absolutely. So are you asking more on the aesthetic side?
Well, let's start with the aesthetic side, and then let's go on, because again, they're both. They're both super interesting, and they both are their own businesses. So it's this is really for both.
Right. So as far as the aesthetics, my approach was, I knew I had to start somewhere. So I took a couple weekend courses, very quickly, realized that wow, there's a lot more to this, and that a couple weekend courses is going to have me ready, to launch. And so I started seeking out, again, mentors that could teach me. I would go spend some time in their clinics. I had, because I was moving the practice at the time, I had, a build out that was happening here. So, I was fortunate enough to have 6 months or a year where I could really dive in and start to, educate myself. But I definitely think, seeking out trainings, weekend conferences, and again, finding a mentor, and I think AmSpa is a great place for that. And so, I think AmSpa would be, if I knew now what I knew then, that would be the place I would start probably,
Well,
but yeah.
And you said something interesting and I've heard this before, but it's not always easy. Seeking out mentors, right? Finding those people who can
Yeah.
help you. It is a great idea. I think it's essential, but it's also not super easy, right? Because you have to
Yeah.
find folks that are willing to share. I think in aesthetics, there are a lot of folks who are very willing to share, which is maybe better than some other industries.
Yeah.
How did you find these folks? Like, was it just kind of like online searching, phone calls? Like, how did you do it?
No, actually, the trainings are a great place to network and find folks.
Yeah.
And so, and I found that, especially in the aesthetic industry, it seems that, we all want it to evolve and to be safe, and we're willing to share our knowledge, I think, which is really, amazing. And again, I think AmSpa is a great place. If you come and do a training there, the networking, networking you can do there. Everybody's very willing and open to share their information. And then I think it's a great place to find mentors, really, is at trainings.
Yeah. No, I mean,
Absolutely.
I appreciate that. That's,
Yeah.
certainly, it's any conferences really, as long as you're getting people that are kind of, in your same vein. I think what we've been lucky about at AmSpa is that we've had a lot of folks who are in the same position. They're physicians just like you,
Yeah.
or they're nurse practitioners or PAs, and
Yes.
they often
Yeah.
come from other verticals. Their story is remarkably similar to yours. It's just,
Yeah.
not super happy with the way, the clinics are run with insurance, not enough time.
Okay.
Along those lines, we were talking before we hit record on this about, how med spas and aesthetics really have kind of an opportunity to be leaders in developing this whole health, whole body health
Yeah.
concept, which it's weird because you mentioned A4M, and there's this
Mm-hmm.
wellness side to it, and then you've got aesthetics, and all of is still developing. It's not really reached kind of the mainstream medicine yet, but when you
Yep.
think about it, it should be, right? Because you are talking
And it
about
has
health,
to be.
and it has to be. So
Yes.
talk about that a little bit. Like, what do you see as the future, and how do you
Right.
think med spas play a role in that?
Absolutely. So, and it's been, I mean, I saw this as early as, maybe 2017, 2018. I knew medicine had to shift, and it was one thing that was really awesome, when I got into aesthetics, noticing how many folks that, would come into the aesthetic practice and they are ready to take care of themselves or willing to spend their hard-earned money to look better. And those folks were right, to feel better on the inside and vice versa. And, I think we did an article a while back, the way to full body wellness, and that was 2 or 3 years ago. And I even said then, I think that, the aesthetic industry is, has this amazing opportunity to be that conduit to help bring in more people, and folks are seeking out aesthetic, procedures, at younger and younger ages. Those folks are lost to doctors for a long time. There's not a way to capture them. And so there's a unique opportunity to get a hold of folks at a younger age when they typically wouldn't be seeing doctors, and then to educate them, give them tools that they can use to prevent disease, keep themselves healthy. And on that note, I think that's really where we're going to see this change in medicine is if, we can make the person, the captain of their own health ship. The idea was the primary care was supposed to do that for you, but I think that ship's kind of sailed, right?
Mhm.
If we don't empower the person, they don't have enough medical knowledge and how to take care of themselves, the likelihood of them ending up with chronic disease is pretty great. And so, again, I think the aesthetic industry has this really unique opportunity to provide that care to people. And I think
Yeah, for
that's for a
sure.
couple of reasons. Yeah.
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 I know. And if is there anything else you were going to add there?
Yeah, I think, the fact that we're in a cash-based model,
Yeah.
I think,
Mhm.
aesthetic providers are very open to, educating themselves and evolving, especially because
Yeah.
of the way, aesthetics move so quickly and is evolving. We're constantly having to learn. It seems that aesthetic providers are, hungry for knowledge, and to evolve with the industry. And so I think that, you know, makes them perfect providers for, bringing in this new type of medicine. And I think, the introduction of GLP-1s really proved that. I think that, it was pretty amazing to watch. I did a speech, um, right back after COVID, and I remember asking how many folks were using GLP-1s, and there was just a small handful of folks. And then
Yeah.
this past, April, I asked again, and every hand in the room went up, and so it was like,
Yeah.
wow, in that short of period of time, the entire industry evolved to, to incorporate these into practice. And it just shows,
Yeah.
how quickly I think that, the aesthetic industry can, evolve into providing that next level care. I think a couple other really interesting things, about the aesthetic industry is that, it's all cash based. The providers
Mhm.
can practice, and set their practice up the way they see fit. And
Mhm.
nobody is going to tell them, how to see patients, what tests they can order, and they're not being dictated how they practice. And then, the other thing I think is pretty special is that, we have the time to educate our patients,
Right.
right? And we are used to educating our patients on aesthetic treatments, and really gaining that confidence, and trust in our patients. And that's, building that rapport and being able to connect with those people, or with our patients. That's how you really are going to provide that next level care to them.
Yeah, you've mentioned that a few times. I would love to kind of unpack that a little bit. The time that you get to spend with your patients. You've mentioned that was one of the issues that you had with kind of, the insurance industry and general care. Um, and what's your kind of education slash consult process like when you bring these new patients in? How much time do you
Yeah.
spend with them, and how are you, given that you've got aesthetics and you've got wellness, you've got all these different things going together? How do you fit all that in and talk about the entire plan?
Right. So, you know, it's, and I like to kind of compare, a traditional setting to what we do, and just to kind of show the contrast between those. So you have, someone comes in, and, they are diagnosed with high blood pressure. The appointment lasts 5 to maybe 15 minutes. And very quickly they're offered a medication. We say, you know, go home, do some education. I mean, do some, do some, lifestyle and nutrition changes, some exercise, and we'll see you back in 3 to 6 months.
Mhm.
When a patient comes through our doors, they're placed on just to initiate care. We place them on a body composition analyzer. We get blood work that is 100 plus biomarkers. And the initial consult with myself is an hour and a half. And
Really?
there's about 45 minutes of that consult that is me getting to know that patient, learning them inside and out, all of their habits, even down to, all of their personal information about, um, if they have their daughter's wedding coming up, or how often they eat out. I mean, it's really getting to know that person, on another level. And then we educate them on the blood work. We educate them on body composition, on muscle mass and fat mass and percent body fat. And that lays the foundation for us, being able to take better care of them. And
Mhm.
by building that rapport and educating them, when we recommend a treatment or a lifestyle plan after that, they know why, they've been educated on why. And that makes it, it's more likely then that they're going to execute that plan, building that
Mhm.
trust with them. And then if you don't get to know the person, then it's really hard for you to build that perfect plan for them. And I
Mhm.
think that's what makes us so successful in getting those outcomes with folks.
So I have a couple thoughts and questions on that, which I think is interesting. hour and a half is a long time for a consult from
It is.
my experience talking with folks. How are you managing that? Because that, like, say you were to do 3 or 4 of those a day, let's say that
Mhm.
takes up your whole day. How do you
Exactly.
manage that with as far as timing and patient flow to be able to spend that kind of time with folks?
Absolutely. So, you know, I was seeing maybe two, sometimes three a day. And then I put a
Hmm.
couple of aesthetic consults in there. Half my time spent with the health side and half is spent with aesthetics.
Okay.
We've I've talked a lot about cutting back on the amount of time in the consult, but because our outcomes are so good and we retain our patients, I think if we were to cut it down, I just don't think we get the same outcome. And
Hmm.
so our patients, once they come into the practice, they stay with us, and I think
Yeah.
part of that, is building that foundation with them. And, I've had a lot of practitioners say, well, that's just too much time. I can do it in 45 minutes. But I
Hmm.
just don't see them getting the same outcomes we are. And so,
Hmm.
battled with, okay, well, some of the educational stuff I can do modules and teach them, but you still, that face-to-face interaction, with the patient and spending the time with them, that's what I think helps them to buy in and to really execute, what you're
Yeah,
trying to get them to do.
for sure.
Yeah.
Does and during that time that you're doing the consult, and you mentioned you kind of break it into wellness and aesthetics, which makes sense. But do you get into the aesthetic side with folks who come in for wellness right away, and at least say, hey, down the road, if you, as here's what's available to you, here's what we can do, or is it
Yes.
just focus on one or the other? Hey folks, it's Alex Thiersch. When it comes to injecting in the face, safety is more than skin deep. One wrong move could cause serious injury, hurt your reputation, and possibly endanger your business. That is why AmSpa partnered with the Academy for Injection Anatomy to create the AIA Advanced Cadaver Course, the most thorough and advanced facial anatomy course in the industry. Created and taught by renowned board-certified plastic surgeon Dr. Chris Surik, one of the foremost facial anatomists in the world, along with his hand-chosen faculty of the most experienced injectors in the industry. Students experience firsthand and close-up the anatomy of the face so that they can inject safely and confidently. Unlike other cadaver courses with large groups or limited access, the AIA Advanced Cadaver Course provides small group instruction with a high faculty to student ratio and a limit of 4 students per cadaver specimen. Everyone who attends gets a chance to inject real product and then dissect cross-sectionally to see how close they came to vessels and other important structures of the face. This hands-on cadaver lab follows a full day of instruction on facial anatomy from our world-renowned faculty, including discussions of complication management, rheology, and an introduction to the use of ultrasound in your practice by Dr. Steve Weiner, one of the pioneers of using ultrasound with facial injections. At this 2 day course, students learn how to avoid common danger zones, how dermal fillers behave, and the best places to place product for safe, outstanding results. More than 3,000 aesthetic injectors have improved the safety and efficacy of their injection techniques with the AIA Advanced Cadaver Course. Now it's your turn. Visit AmericanMedSpa.org/AIA Advanced. Start your journey to safer injecting today. The AIA Cadaver Course will be in New York City on September 20th, Nashville on October 18th, and finally in Orlando on November 8th. See you there.
Well, it depends on the person. And I think that's
Yeah.
part of getting to know them. And, through the course of that time I spend with them, you learn them and you kind of know the vibe. And I can start to tell, is this person going to be open to the aesthetics?
Mhm.
Is it something they're really interested in? And, as I work with folks and gain their trust, some people, when they first walk through the door, maybe they weren't an aesthetic patient at the time, but then they become one eventually,
Yeah.
as we're working together, and vice versa. We have folks who come in on the aesthetic side and they've been with me for 2 years and have amazing outcomes. And, then we take the plunge into the wellness side eventually, in talking with them during their consult, you know, they may tell me, and I ask them how they're doing. Well, I'm not sleeping so great. And maybe they're in the beginnings of menopause. And then I say, well, why don't we get some hormones and we'll take a look, let's run some blood work. And then, we look at the whole person when they come in
Yeah.
for the health side. And so through that education, we're able a lot of times to uncover all kinds of things. We're diagnosing folks in here with insulin resistance every day that come in on the aesthetic side. And so they don't even, if the primary care doctor, they've been flying under the radar and we'll discover that,
Yeah.
and so, it's been pretty rewarding being able to, even change
Yeah.
people's health when they come in for aesthetics.
I can see that. And is the consult, the time and the substance of the consult the same for regardless if it's a aesthetic patient or a wellness patient, or is, you said you do aesthetic consults, are those a little bit different because they're probably coming in for something more visually based?
Absolutely. So I do, we book about 30 minutes for an aesthetic consult.
Okay. All right.
And sometimes we'll do treatment the same day. Like they know
Yeah.
they're coming in for Dysport or Botox,
Mhm.
or, a neuromodulator, but, usually about a half an hour for those.
Okay, gotcha.
Yeah.
And then they must know, if they're coming in for aesthetics, given the name, given what you're offering, that these other things are out there. But how do you introduce? Do you introduce in that first aesthetic consult some of these ideas of wellness and health and hormones, or is it more focused on aesthetics? And as you get to know them over time, you kind of start bringing that in. And I'm just curious because it's a lot of folks that we work with are in aesthetics first, like I mentioned at the beginning.
Right.
And then and what one thing they're finding difficult is bringing that side of things in and how to talk about it with someone who is there for Botox, right? They're there to
Right.
have their face and feel more comfortable about the way they look. But it's all tied together. So how do you do that? How do you accomplish that?
Definitely. So, and I definitely bring it up in that initial consult, in that initial meeting, because, the number one way really to take care of the outside is to take care of the inside. And so, I actually lead with that. So I talk about what are the things that are going to help us slow the aging, of the face, right? And that's why they're there, or help prevent or even reverse, right? So the number one thing people can do is take care of the inside. And some of that sometimes as we age is hormone management. And we make them aware of that. And so that helps to open up that conversation. And then we dive into all the other modalities and, long-term plan for them to reach their aesthetic,
Yeah.
what they would
Yeah.
like to reach aesthetically.
Yeah.
Yeah.
It's so important. And that's such a good point because it's like you can't really have one without the other. What about the
Right.
mental health side? How are you addressing that? Because that's a big part of it too. Folks that are,
Absolutely.
depressed or what, for whatever reason, they're going to have trouble sticking with plans and following instructions and doing what needs to be done.
Right. Absolutely. So, I think that's also part of being a good aesthetic provider is, asking all those questions, right? So,
Yeah.
you got to look at the medical history. And if you've taken a good medical history, especially on the intake, and then you review that before you see the patient, just like you said, you may notice there's anxiety or depression there. And you can dig into that a little bit during that consult. How do you feel like that's managed well? And sometimes it can be as simple as educating them on, sometimes as hormones decline, even as early as mid-30s, 40s, we can see progesterone drop. That can cause anxiety and depression in folks. Nobody's really looking at that. There's, if you're well educated on, wellness, and you can pick these things out pretty quickly and then educate them while they're in your chair. And that helps you right there acquire that health patient. So I think it's
Sure.
just, learning how to define those things. And as you practice it, you get better and better at transitioning those patients from the aesthetic side into the health side.
Yeah. So
Yeah.
how big's your space right now? Like what's your,
Yeah.
like, are you,
Yeah.
5 rooms, you got multiple locations? What's your practice
Yeah.
look?
So right now we are 2,000 square feet.
Mhm.
We were fortunate enough when we found the space, it was dirt, so I could build it the suite. We have 2 procedure rooms, 3 exam rooms, and a couple other rooms for patient care that are kind of
Do you have a
designated for
kitchen?
that. We do not have a kitchen. All right, we don't have a kitchen, and we don't have
Damn
a
it.
training facility here. But maybe one day, it's still, in my like moonshot dream clinic.
Yeah.
But we've partnered with a lot of it. We work with a lot of professional athletes too, and so we partnered with some of the local training facilities around here, and local gyms. We partner with them, and so we have places that we can send our patients. And we also have private chefs that we work with, that can
Okay.
actually help make the food for folks.
Mhm.
And we have, nutrition coaching, health coaching, and accountability coaching. Our team is very robust and can educate people on that part. But maybe the kitchen's in the future. But we're kind of we're 14 now, our team,
Yeah.
and we're kind
Yeah.
of on top of each other in here. But
Yeah.
we do have plans to expand, definitely.
I mean,
Yeah,
isn't that the truth? Whenever I talk to folks who are like you, who are getting ready to open and they're getting a place, I'm like, make sure you got room to expand because it's going to grow
yeah,
faster than you think, right?
100%.
Yeah, it
And
does.
we could use another 2,000, I think, probably. You know.
Wow. Well, so you've mentioned hormones, and obviously there's a lot of folks that are getting into that. We're seeing a lot of the kind of the rejuvenating aesthetic side. We're seeing, peptides, things like that.
Mhm.
What's kind of the hottest treatment that you're doing right now, or the one that you're most excited about?
Absolutely. So I think we, even before, Ozempic came out and this whole GLP-1 craze took off, we were already using GLP-1s in our practice, for
Hmm.
weight loss, and a little differently than they're being used now. And we were really excited about that because of the results we were getting. But then, we also knew that, helping people maintain their muscle mass, improve muscle quality, is a big part of helping people age better. And so some of the, treatments that we can use to help people maintain muscle, getting them, to exercise, and the lifestyle part is really the part that gets me fired up. Because I know
Yeah.
that, if we can get folks, dialed in on that, that's what's going to help them avoid chronic disease and maintain good health long term. So, I know that the education part, the lifestyle part, the nutrition part, it's not like as sexy as the treatments and stuff like that. But, I think that's where, the biggest bang for your buck is in that education,
Yeah.
for sure.
Yeah,
Yeah.
for sure. Well, and I had a conversation not long ago with a doctor who runs a fairly similar practice to yours, and one of the things that she does is she incorporates what she calls kind of mandatory strength training for folks who are on the GLP-1s, right? Because
Yeah,
the one of the
absolutely.
things that we're seeing is, the Ozempic body where
Hmm.
folks are losing some of their muscle mass. How do you deal with that? Because that's the one thing that in talking to folks who are thinking about doing GLP-1s, they tend to get a little nervous about that because they're like, I don't want to
Right.
look like some of those people that I see. How do you address that and deal with that?
Absolutely. So actually, we get body composition readings on all of our patients. If they're going to go on a GLP-1, it's mandatory that they hop on a body composition analyzer, a bioimpedance machine, and that we
Mhm.
are tracking their muscle mass. And if, as time goes on, if we're not getting updated BIAs on them, bioimpedance readings, then we actually cut the prescription off, because, we want to make sure that we're going to put that person into a better state of health, that, we haven't damaged their metabolically active tissue and harmed them.
Right.
Because we see a lot of that. There's advertisements all around us that say no exercise, no diet needed, and the GLP-1s were really never, they shouldn't be this like magic bullet. It should have
Mhm.
been a tool that we use to kind of turn down the food noise, help people make sustainable lifestyle changes, nutrition changes. And it's a tool, it's not this magic bullet, and so we are focused on, the nutritional education. If we don't think people are doing what they need to do there, then they may not be the best fit for us.
Yeah.
Yeah.
Well,
That's kind of how it goes.
it's interesting that you raised, you see a lot of ads. I just saw an ad, I think this morning from, some company offering the GLP-1s, and it was, fully remote telemedicine. And I think there was even I can't remember exactly what it was, but there was some comment where it was like, no need for those, time consuming, annoying face-to-face consultations with the doctor. Right. And they
Right.
literally had said that. And I was like, that's bonkers to me, number one.
Right.
But then number two, one of the things we've been working on at AmSpa, and you took part in, as far as a blog that we wrote recently about, safe medical spas,
Definitely.
is part of it is that, right? Like, how do we, like, there's so much noise out there, and there's so much, to be honest, there's so much money being made off of these treatments that people are
100%.
are starting to say things and do things that not even to say that they're unsafe, but it kind of reflects poorly on the rest of us, because someone like you who's
100%.
taking the time to do these long consultations, educate their patients, make sure that they're set up for long-term success.
Yeah.
What can we as an industry do about that? Because it does get a bit annoying when I see those things. 'Cause it's like, that's not how we
Right.
operate.
100%. And I think, you know, it really falls on the provider. I think that, as medical professionals, we have a duty to our patients to protect them. And I think, and I've seen this, sometimes where there's non-medical folks that are, involved in a business and they treat it like a business. And then the provider, who is an employee of theirs, is put under pressure to, execute, maybe prescribe hormones, right? Maybe they don't have the
That's
training or
right.
didn't feel comfortable for that. And then their job depends on that. And now they're in a situation where maybe they don't have the training necessary to, to execute those treatments and manage them, properly. But I think, it's on the provider then to say, listen, I don't feel comfortable with this. We need to protect our patients, or maybe I need further training on this before we can bring this into the business. Because I've had multiple folks come to me and tell me that that's what they're dealing with, and so I
Right.
think, supporting our providers and making sure that, they feel comfortable, and making sure that they, have the proper training. I think that's where we can really make an impact there.
Yeah, no,
Yeah.
100%. I think you're dead on, and we're seeing a lot more corporate involvement
Right.
in healthcare in general, and certainly
Yeah.
that's happening in aesthetics, and it's happening in wellness as well. I mean, certainly the IV space is huge with
Uh-huh.
that, where you've got a lot of folks who are non-physician owners. Um, I'm just kind of curious, because you've come a long way in a couple of years. You obviously are onto something with how you're approaching it, and how you're marketing it. By the way, are your patients mostly on the younger side or older, or is it kind of the whole gamut?
It's the whole gamut. I mean, we have folks in, from, young adults up to 80 years old. And,
Okay.
it's pretty wild. I mean, we joke around, we'll have like 3 generations of folks, it's like one,
Yeah.
someone in their, mid 30s or 40s comes in looking for a little weight loss. The next thing I know, I'm seeing their kid and their parents and their aunts and uncles. And so,
Yeah.
it really is, I think, this preventative space is for everyone. And, which is, pretty exciting, that even
I
younger
agree.
folks now are seeing, hey, I need to take care of myself, because if I do, then I'm going to be able to avoid that chronic disease down the
Yeah,
line, which is
absolutely.
pretty neat.
What's
Yeah.
the having been in this for, gosh, you're going on 10 years, I guess, to being on your own completely, right? I mean, from
Coming
2016,
up.
and I know it was slightly different. What's the what's your main driver for patients that are coming in? Are you an Instagram guy, or is it how does that work?
We've been super fortunate. I think, you know, we have this amazing team and a great vibe. And, I think our patients, feel that we really care about them. And our word of mouth is just, it's driven it, and we don't really do a ton of Instagram. We don't really do any advertising. It's been straight word of mouth. I
Really?
do have plans to start to try to branch out from that a little bit as we grow, for our expansion plans. But it's mostly been just word of mouth. And, we do
That's
see
amazing.
some patients through telemedicine. I want to go back and touch on how, having people do body, just for, our providers out there, if you are doing telemedicine, there are, BIA machines all over now. So like Orange Theory has them in them. So you can still manage people through telemedicine.
For sure. For sure.
You have them go in, they get one of those done. And then there are at home use machines too, that
For
are,
sure.
maybe $300 now. People can
Yeah.
monitor their muscle mass at home. Yeah.
Yeah. No, for sure. And I mean, I absolutely agree. I think telemedicine is, it's opened up a lot of doors for people, and it's gonna allow folks, when they hear your voice, they see you, they're gonna want to treat with you particularly, and it allows you to do that. Um, I think, one of the things I was thinking about was the way that this ad that I heard, they were trying to make it seem like you don't need to even see the doctor, right? Like that's kind of an
Right.
afterthought. It's like, this is a quick, you call up, we'll get you your GLP-1, you'll
Yep.
be off and running. And that's the risk, right? When you make it easy for folks to log on
Yep.
and do a telemedicine appointment, you always want to make sure, and this is just the law of compliance. You want to make sure that what the treatment and the consult that you're providing to the patient is the same as if you were, in person, and the same things that you're
Exactly.
doing.
Absolutely. And again, I think that's partly on the provider, and I think then also, the consumer, the patient needs to be well educated, and that's why, platforms like this, getting the word out there, making sure people know, hey, what does a safe med spa visit look like? What does a safe wellness visit or weight loss visit look like? I think us getting that message out there, and making sure people are well educated, because, just in industries like this, there's a rapid growth. There's a lot, like you mentioned earlier, a lot of money to be made. It's there's going to be some bad actors out there, and people need to be
For sure.
aware and able to watch out for that.
Yeah.
And
No, I totally agree. It's anytime you're in an industry where there's money to be made, you're going to see the best and the worst of people come out, right? Especially in healthcare. And so it's, yeah, I mean, it's something that we're dealing with right now. And I think as an industry, the faster that we can start dealing with it internally, set our own parameters and figure out how we're going to operate as an industry, and what standards we're going to hold ourselves to, that will be better than ultimately allowing external forces do it for us, which is kind of what we're starting to see. We're starting to see some of these medical boards who don't really understand how it works, come in and do things. So educating the public is huge.
Absolutely. And, one thing that OneLife set out to do, when we first opened, was to make sure that, we presented ourselves in a way that general medicine could be accepting of, the new path that we're trying to do. So went out and introducing ourselves, partnering with other physicians, educating them on what we're actually doing here. There have been times that I got pushback. I'd have a patient come in and they say, my primary care doctor says that, hormone replacement causes cancer. Or, they say, don't do those weight loss treatments. That's voodoo medicine or something. And that was before, the GLP-1s had really gotten into the general public. And so, also educating the other providers and making sure that we're doing things right, so that, there's not this, it's all, I know that there's some hormone clinics too that, their main goal is just to put every person on a hormone, even if their levels aren't low. Right. And then that person actually is then stuck on that hormone for life, if it's a male. And that's part of their business model. And this is given, some of these therapies that can be life-changing and prevent disease in people kind of a bad rep. And so, it's important for us to, like you said, to set those boundaries, make sure that the industry is doing everything the way it should be done. And And I think,
Yeah.
the types of providers that are coming to AmSpa want to be the best. And I think, I hope that the aesthetic industry, can lead that path. Yeah.
Yeah, I agree. And I think what's exciting, and I'm grateful that we've had a chance to work with you. And by the way, you've spoken at Medical Spa Show. I'm sure we'll have you back in 25. But
Hopefully.
what I think is exciting is that the aesthetic side, medical spas, even more so than, when you think about plastic surgeons and derms, who are also in the industry, we have
And
the ability to take a true leadership role in this and really shape the way that we are viewed. But that's only going to happen if we come together, and number one, and then number two, just make sure that we all agree on what we should be doing, what we shouldn't be doing. But I think that's exciting. I mean, there's
absolutely.
you're a young guy, you've got a lot of time ahead of you. There's a lot of really good, smart young providers who are reaching the masses through social media,
Definitely.
and the ability to take that leadership position, I think is not only responsible of us, but it's a huge opportunity, right?
100%. Absolutely. And, and I, I see it, I could see that, just like I mentioned earlier, with how quickly, the GLP-1s were incorporated. And, I think, same for whatever we want to call it, longevity, human performance, functional medicine, taking, this preventative, proactive, personalized approach to medicine in this space, I think is going to be, an absolute game changer. And like we've been talking about, I mean, it's a huge opportunity. Yeah. And I think aesthetics, that can lead the way.
I agree. I
Yeah.
totally agree. So what's next for you in your practice? I mean, you're obviously
Yeah.
growing. It's a very impressive that you're basically basically a word of mouth practice at this point,
Hmm.
and having not done a whole lot of social media,
Yeah.
and other advertising and marketing. What do you see next? You need more
Yeah.
space? I mean, are you looking to expand more locations? What's your thought?
I think so. So, we are going to be launching a little kiosk that kind of, helps us do a small expansion without a full location. And this is going to go into, one of the local communities that are here. And that'll give us access to those folks. A lot of our patients already live in that community, and that way they don't have to come off site. So we thought that
Yeah,
it would
that's awesome.
be a nice way to kind of, to branch out. Part of, the reason that I think we haven't opened a second clinic yet is that I have to make sure that the standard of care stays. And,
Yeah.
we built this amazing team here, and, we're going to try to build a training program for, our providers that come in. And then, as we, I think, get everyone up to speed and we can keep that continuity of care, then we would, branch out and open our
That's
next
awesome.
full second location, which is
I'm
good.
so curious. You call it a kiosk. What does that look like? Like what do
Yeah.
you mean? I'm thinking like a
Well,
tiny
so
house or a Sprinter van.
right. No. So it's, a smaller space where
Yeah,
we won't have, everything on site, the laser treatments and all of that, but we can draw blood there. We have a body composition analyzer, and this is going into a community health center
gotcha.
where these folks are, they're coming in to work out. Um, I think, folks that are already taking care of themselves and they're going to the gym. This is these are a demographic of people that already have a piece of that health puzzle that a lot of times is missing. And so educating them on nutrition, and they're just right, I think, to take on that preventative approach if their mind's already there. And so, I think this is, part of a model that I think could really work, if we focus on folks that already have the mind, they want to stay healthy, they're young and active, and then we can grab them then and educate them on how to keep themselves healthy as they age.
Mhm.
That's how we're going to make a big, long lasting impact
Yeah,
on
for
their
sure.
health. Yeah.
Well, I'm still looking for the a doctor who can make me look like Ryan Gosling. I can jump like Michael Jordan. Let's see what else. Something like that, where just a couple shots and I'm good to go.
Yeah,
And,
man.
yeah.
Well, I think you got to come to OneLife then.
All right.
Yeah.
Oh man. Well, where can folks? I know there's going to be people who want to, would love to get more information about you and potentially,
Absolutely.
learn from you. What's the best way that folks can get a hold of you?
Absolutely. Well, I'm on Instagram. I'm Dr. Palm Beach. I have my amazing wife to thank for that handle. She's our marketing
Yeah.
genius. And or my email is K, first initial, last name WINNARD MD @olhp.com, or you can
Okay.
just call our clinic.
Yeah.
Yep,
Yeah. And you're easy to find online. I saw
absolutely.
you've got a really dynamic, cool website. I was checking it out. That's got a lot of information. Um,
Thank you.
and I appreciate you taking the time to talk to us. We've been talking for almost an hour. It's kind of flown by.
Awesome.
We'll have to have you back
Thanks, Alex.
and talk further and get updated on how you're doing, how that kiosk is going.
Absolutely. Well, thank
All
you,
right.
Alex. Yeah, thanks everybody.
Sounds
All
good.
right.
Thank you.
Thank you.
Thank you for watching the Medical Spa Insider podcast. Please make sure to subscribe to our channel for future videos and podcasts. For more information about the American Med Spa Association, please check our description below.